Thank you, Ran, very much for inviting me to this, I think, one of the very important meetings we have during these difficult times we are in right now. The COVID-19 has been hitting Sweden quite a lot, as you probably know. We have more than 80,000 detected cases so far. 2,500 people have been treated in intensive care so far, even if that number is lowering very quickly. We have more than 5,500 deaths so far. We could add that the deaths we are counting is anybody with a positive PCR for COVID-19 who died within 30 days of the diagnosis. So it's a very high coverage of death, so we don't really miss very many. And we can also compare it to the excess mortality, and we are very close to that. So there are probably fairly few cases that we actually miss. And in Sweden, like in most places, it's mainly the elderly who are the background to the mortality, especially people over 85 years of age. And it's been hitting the elderly homes, the long-term care facilities in Sweden very much. There's been a lot of discussion about seroprevalence and about herd immunity and so on. We have been trying to measure it in a number of different ways. One of our biggest tryouts, we found about 10% of the Stockholm population were immune, but measured in different areas, in different places and so on. Sometimes we measure workplaces that have 25% immunity, so it seems like the immunity is very heterogeneous. This 10% is blood donors, and in that group it's fairly low. If you look at the hospital staff, even administrative staff in a hospital, you get up about 20%. So it's rather difficult to measure, and it's been measured many times in different parts of Sweden. We get very different figures overall. So what we've been working with is a combination of binding regulations and general advice. Binding regulations includes, like in most countries, ban on visiting nursing homes, of course. Distance education for universities and secondary schools, and we banned big gatherings, first 500 and now we're down to 50 people. And we have also initiated a number of regulations for restaurants and cafes to minimize the spreads in those areas which we know is the high-risk places. And as I said, we also communicated a number of recommendations to the public to stay home when you're sick, of course. For people over 70, try to minimize their social contacts with other people as much as possible. We try to limit the travel as much as possible during a long time. And we also told people to work at home as much as possible. And that has probably had quite a great impact in Sweden, since many people already work at home now and then. And the background to this is the Communicable Disease Act in Sweden, which is most of the legal basis for doing these things. We have also a long tradition of a high level of trust between the population and the agencies. I mean, we usually mention our vaccination program as one aspect of that, where we reach 98% of the children with a completely voluntary program. So there is a lot of faith in that the agency is trying to do good things. The healthcare services adapted, I think, in a wonderful way. And at any given time, we had at least 30% of our ICU beds were empty. So there was always room for more patients. The number of ICU beds were doubled at the peak compared to what we normally have. And the public response has been fantastic, I would say. More than 80% of the people say when you ask them that they adapted their lifestyle in this new time. And the level of trust for the agency has increased. So we are at least 75% of the population say that there are a high level of trust in the agency and also in healthcare institutions in general. And it's important to keep essential health services in place, not only COVID-19, but also other things, especially for normally underserved populations. And we have seen at least signals of suppressed use of health services. For example, the number of people who came to emergency wards with possible heart complaints and so on diminished quite a lot. And what impact that will have over the long term is still too early to. Now, there's been a lot of talk about that we wanted to reach herd immunity as quickly as possible. And in that way, we allowed or even maybe encourage people to get infected. But that's, of course, definitely not true. I mean, the main purpose the whole time has to be trying to get transmission as low as possible with reasonable means, and thereby having healthcare that can cope and keep on delivering high quality services to everybody. So that's been quite clear. We all know that this disease can, even if it doesn't happen very often, can be quite dangerous to almost anybody. People often compare, or especially in the past, I think it's not so much anymore, compared COVID-19 to the flu. And of course, there are similarities, but this is by sheer impact, so many people being sick at the same time. This has a completely different impact, both on the individuals, but also on society as a whole. So I think it's a reasonable comparison to do over time, because we can learn a lot from it. But at this time, I think the message can sometimes be wrongly understood if you compare it to the flu, because this is really much worse for society, which I think most countries can tell you these days.
Knowing what we do know now, in Sweden's experience to date, which policies and practices would you leave unchanged? Which decisions that you've made in the past are you really most proud of?
I think a few things. I think one thing that was very important from the beginning was the sustainability, which I mentioned before. To have measures in place that people can live with for a long time, since we're going to have to live with this disease for a long time. I think one thing that we're very happy about that we did is to not close the schools. Because closing schools causes a lot of problems for many, many people, for the parents, because they can't go to work, for healthcare, because they're going to lose a lot of people working there because they have to stay home with their children, but not least for the children, because not being able to go to school really can have a lot of damage to children, especially children who are already vulnerable or already in a bad situation. Not being able to go to school, to get lunches at school, to be able to leave school with levels so that they can move on into other educational levels in the society is so important. And I think we're all very, very happy. Both, and I get a lot of mails from parents, I get a lot of mails from teachers and others saying how happy they are about that we kept the schools open. And as I said, we had made a comparison with Finland recently, and we cannot see that the impact of children or parents are any different in Sweden and Finland, in spite of this. Finland closed schools and we kept them open. So I think we can be quite happy about that. This does not have a negative impact, but especially in the long run, it will have a lot of positive impacts if you'll be able to keep the schools open.
Did you change the way schools are running? Did you switch them to capsules or mandate masks? Did you just change it?
No, not masks and not capsules like that, but we gave advice to the schools to try to do as much social distancing as possible. So we said, try to avoid big gatherings. Many schools have big gatherings in the mornings. Try to arrange your school lunches, because everybody in Sweden eats lunch together at school, so that not too many people are crowding the lunch areas at the same time. Try to be outdoors whenever you can. So these kind of advice for the schools to use as much as possible, depending on the local situation, we're given, but not anything more stringent than that.
Which decisions that were made during the crisis, in Sweden and globally, we are most likely to regret?
I think we will regret closing the borders to the extent that we did. I think a lot of experience from other pandemics in the past shows very clearly that closing borders and restricting travel between countries and so on is not really very efficient, and to a certain extent also harms public health response. I mean, that was clear in West Africa during the Ebola outbreak. And I think it's also quite clear now when we're trying to open borders again. It's interesting that it seems to be really easy to close a border, but to open it up again, that is so much more difficult. And in the European Union, it changed things, I think, in a very dramatic way. We are used to open borders in the European Union. And suddenly we have regulations saying that where we can go and where we can't go in between the European countries. And I think that would be something we remember for a long time. And I think we're also going to regret it for a long time that we took these kind of measures. It's often been discussed if what we have done in Sweden can only be done in Sweden. But I think the truth is that every country will have to sort of adapt their response to the possibilities within their country. certain things we can learn from each other, I'm sure, like schools, for example, that children are not the drivers of this pandemic like they are with flu and other diseases, that we can learn from each other. But for many things, we need to adapt them very clearly to the situation where we are. But I think another important thing is when we do that, we also need to think not only about how well we can stop the pandemic from spreading, but also what kind of are the consequences of closing down society. I think it's quite scary to hear the stories from South Africa and other countries where poor people who have a very hard time to survive in any kind of circumstances. But when you close down society, you really hit the vulnerable populations a lot more than anybody else. And I think that's something you need to take with you when you decide on doing things like that.
Wow, Dr. Tegnell, that was absolutely outstanding. Thank you for sharing so many fresh and innovative ways of looking at this crisis. I do think that we, the epidemiologists, should spend more time together sharing ideas, know-how, success stories, and also failures. So thank you once again.